So you've just been prescribed metformin. Don't worry, in the next few minutes, we're going to turn any of that confusion into total confidence. Think of this as your simple, easy to follow guide for getting started.
Yeah, getting a new prescription can feel like a lot, right? It's totally normal to have questions or even feel a little overwhelmed. So let's clear all that up right now. Look, our goal here is super simple. We want to make sure you feel confident taking this medication, both safely and effectively. And I promise, by the end of this, you're going to know exactly what to do and what to expect.
All right, let's jump right in. We're going to start with the absolute basics, the rules for your daily dose. And trust me, getting this part right from the get-go makes all the difference.
Okay, first things first. You need to grab your prescription bottle and take a look. What does it say? Are you on the standard, immediate release version, or is it the extended release, which you might see marked as ER or XR? This is super important because it completely changes your schedule. The standard kind is usually taken a couple of times a day with meals, but that extended release one, that's typically just once a day with your dinner.
And here it is, the number one golden rule of taking metformin. Ready? Always, always take it with food. This isn't just a suggestion. It's the key to preventing an upset stomach. See, the food acts like a buffer, and that really cuts down on those common side effects like nausea, especially when you're just getting started.
Okay, a few more quick tips for you. Always swallow the pill whole with a big glass of water. Easy enough. Now, this next one is critical, especially if you're on the extended release version. You can never crush, chew, or break those ER tablets. Why? Well, that would break the special coating that's designed to release the medicine slowly. You'd get the whole dose all at once, and we don't want that. And finally, just try to take it around the same time every day. That consistency really helps keep your blood sugar levels nice and stable.
All right, so now you know how to take it, but what can you expect in those first few weeks? Let's talk about it. This is really all about your body getting used to things, so we'll cover side effects and what to do if you miss a dose.
Okay, I'm not gonna lie, it's really common to feel a bit queasy or have a bit of an upset stomach when you first start. But please, don't be alarmed. This is a totally normal part of your body just adjusting to the new medicine. The good news is, for most people, it's pretty mild and it usually fades away within a couple of weeks.
And that's exactly why your doctor uses this strategy called start low, go slow. Makes sense, right? They'll start you on a really small dose, like 500 milligrams, and then slowly increase it over several weeks. This whole approach is designed to give your body plenty of time to adapt, which is the absolute best way to keep those initial side effects to a minimum.
Okay, let's talk about something that can be a little weird, maybe even alarming if you're not expecting it. Have you ever seen something that looks like a whole pill in your stool? I know, it sounds strange, but if you're taking that extended release version, there's a perfectly logical explanation. And no, it definitely doesn't mean the medicine isn't working. What you're seeing is something called a ghost tablet. It's literally just the empty shell of the pill. You see, with the extended release kind, the medication gets slowly absorbed into your body all day long, and what's left over is just this harmless, non-dissolvable shell that passes right through you. So the key thing to remember is you got all the medicine. This is just the leftover packaging, so to speak. Look, life happens. We all get busy, and sometimes you might forget a dose. The first rule is don't panic. It's not a big deal. If you remember pretty soon after you were supposed to take it, go ahead and take it now. Just make sure you have it with some food. But what if it's almost time for your next scheduled dose? In that case, just forget about the one you missed. Just skip it and get right back on your normal schedule. And this brings us to another super important safety rule. No matter what, you should never double up to try and catch up. Taking 2 doses at once is not safe, so just don't do it, ever.
Okay, we've covered the day-to-day stuff. Now let's zoom out and talk about a few key things to keep in mind for your long-term health and safety while you're on metformin. Think of these as important conversation starters for your next doctor's visit.
So there are really 3 big things to be aware of over the long haul. First, alcohol. It's a good idea to limit how much you drink because it can interact with the metformin. Second, vitamin B12. After you've been on metformin for a while, it can sometimes lower your B12 levels, so it's a great idea to ask your doctor to check that with a simple blood test once a year. And third, and this one is a biggie, you always need to tell any doctor, nurse, or technician that you take metformin before you have any medical scans or procedures. Let's dig into that last point about medical scans for a second. We're mainly talking about procedures like X-rays or CT scans, where they inject a special contrast dye to see things better. The thing is, that dye, combined with metformin, can be a little tough on your kidneys. So,
Just as a safety precaution, your doctor will probably tell you to stop taking your metformin for about 48 hours, so 2 days before and 2 days after the scan. Don't worry, the medical staff will give you exact instructions.
Okay, we've covered a lot of ground. So to wrap things up, let's boil it all down to the absolute essentials. Think of this as your metformin cheat sheet. All right, here we go. If you forget everything else, just remember these 4 golden rules. Number 1, your daily habit is to always take it with food and try for the same time each day. Number 2, if you have the ER version, you never ever crush or chew it. Number 3, if you miss a dose, just skip it if it's close to your next one, and definitely never double up. And finally, number 4, always, always tell any doctor or medical staff that you're on metformin. That's really the whole shebang. See, it's not so complicated after all, is it? By understanding these simple rules, you're putting yourself in the driver's seat of your own health. You're totally in control. So here's a final thought for you. How can you make this a totally seamless part of your life? Maybe it's setting a daily alarm on your phone, or maybe it's just putting the pill bottle right next to your dinner plate so you can't miss it. Whatever it is, you've got this.